Welcome back to What's Up Oxford. I'm here now with Colleen Wilson from Southwestern Public Health. So welcome to the show, Colleen.
Thank you. Thanks for having me. So
you're here to tell us how to stay healthy during this cold and flu season.
Yes.
Okay.
Yes. We do know that COVID is still alive and well. It's still a threat in our region, and we are seeing that, especially since the end of September. We have seen cases increase, especially to those individuals that may be more high risk for severe outcome from COVID. We want to make sure that they're as protected as possible. And we are seeing on a daily basis in our region probably about 20 to 30 people that are hospitalized every day due to COVID, even though we're not hearing about it as often anymore.
It's still that high in this region? Wow, yeah, you don't hear about it anymore. So unless it's affecting you, you don't, I mean, myself, I didn't realize the numbers were that high again. Okay, so there's a booster out or a new vaccine that's available?
Yes, we know that the variant XBB is circulating within our region and in Ontario. So there has been a new XBB vaccine that's been released. And as of October 30th, the general public are available to come, or they have that opportunity to come and receive that vaccine. Anyone who's 6 months and older. We do recommend that it's been 6 months since your last COVID vaccination or active COVID infection before you get that. And ideally, we really want the people who have the highest risk for severe outcomes to come and consider vaccination.
Okay. And where are the vaccines available? Are they available at all the local pharmacies like they were before?
Absolutely. Our pharmacies are great partners in helping this fight and get needles in arms. We also have clinics through our health units, both the Woodstock and St. Thomas site. So right now, between the two of them, we usually offer about 3 clinics between the two every week. The one thing is these appointments are filling up very quickly. Okay. So we continue to monitor and we'll add appointments and dates, especially as our staffing and vaccine availability permits.
Okay. So best thing to do would be to go onto the website and you can actually do your booking right there, or to call the 1-833-943-3900?
Absolutely. That's the number of the provincial vaccine booking line. So people can call or they can go online to book appointments. Individuals can go on our area website, the Southwestern Public Health website, just to see what date clinics are and their locations.
Okay. So the testing kits are available again? Okay.
Yes.
And are they still free?
Rapid antigen testing kits are free.
Good, okay.
So we do recommend, especially individuals, again, that are at higher risk for severe outcomes. So those who are maybe older, immunocompromised, have other health conditions. Even if you develop symptoms, even if they're mild, we suggest that people test using a rapid antigen test. So those kits are available at some pharmacies now through family doctors, but we do have them available free at the health unit. You can pick them up. There's a ordering line or an ordering form online that people can also complete. And we've recently had a huge partnership with our area libraries, City of Woodstock and the County of Oxford libraries, as well as St. Thomas Library and the Elgin libraries, where people can go and pick up these kits as well.
Oh, they're available at the libraries too.
Yes.
Excellent.
Yeah.
Okay. So I know during, the real thick of the pandemic, you couldn't turn on the radio or the TV without knowing what the protocols were. So it's been a while since you've really heard anything on the media lately. So if somebody does test positive, what are the protocols now? Before it was, quarantine and lockdown for several days. What is the protocol now?
Ideally, what we say is if you have symptoms now, stay home when you're sick. Basically, if you do test positive for COVID, then we suggest staying at home for at least 24 hours until your symptoms have improved and that you have no fever. Or if you kind of have GI symptoms, then we suggest staying home for 48 hours or longer until those symptoms improve. For those individuals, again, that may have a higher risk for severe outcomes, we'd encourage you to call your doctor or see a pharmacist as soon as possible, because you might be eligible for Paxlovid or an antiviral. So, but you have a window, there's a 5-day window where that treatment would be most effective. So that's why we're encouraging people, especially those with increased risk, to test sooner than later and to call and to follow up.
So there's actually something to help with these symptoms. So for those that maybe have tested positive or are feeling this way, there's there's hope now.
Absolutely.
As before, we just had to suffer through it, but now there's actually something there to help us with these symptoms.
Exactly, especially for that higher risk group. And we really encourage people who use rapid antigen tests. The first test you take, it might test negative. So people often stop and don't test any further. So if you have a negative test, we actually suggest that you wait another 24 to 48 hours and test again.
Okay.
So often at that time, people may test positive.
Okay. And a friendly reminder, make sure always washing your hands, mask if you're feeling more comfortable, obviously, and everybody get in and get their booster shots then.
Absolutely.
Okay. Well, thanks so much for bringing this awareness. I know for myself, I had no idea the numbers were creeping up that way again. So I know if I don't know, there's probably lots of people out there that were not aware.
Absolutely.
So thanks for being on the show.
You're welcome.
We're going to take a short break. We'll be right back.